Suffer a counterpoint of adherence to treatment in child and adolescent chronic renal disease. In the context of chronic disease, renal disease has been highlighted due to an increase in its prevalence and by the marked index of associated morbidity and mortality. In the child and adolescent population, social, emotional, and psychological change may be more impact than clinical ones. Our objectives was to reflect on the suffering caused by the routine imposed by the chronic renal disease and its correlation with adherence to the treatment by children and adolescents in hemodialysis treatment. We use a descriptive and exploratory field research with a qualitative approach focused on the educational process in the health teaching. The population is constituted by patients and relatives and professionals. For the analysis of the dates, we opted for content analysis in the modality of thematic analysis. And in the final sample consists of the 7 patients between 10 and 14 years old, correspond to 8,900% of children on hemodialysis in the city. In the categorization of the data emerged these categories like socioeconomic conditioners, support network, educational exclusion, and impact of suffering in the adhesion. It was found that 4 families had a monthly income of less than $450, as well as the absence of home, suggesting the precarious condition can culminate with social determinants of health related to the development of disease. In this study, only 2 participants were residents in the city, and the main displaced to perform at their hemodialysis sessions was 3 hours, making it difficult to continue in the health service. The routine imposed by the treatment can contribute to the educational exclusion, since all participants present losses related to the school attendance. Besides this fact, 5 demonstrate partial knowledge about its pathology and treatment, as well as fragile adherence to therapy to prevent complications. Feelings such as anxiety and fear relate to the occurrence of complications and painful procedures, as well as the social isolation determined by the restriction of or stereotypes about this disease were also reported. In the child and adolescent population, change usually have a great impact mainly on quality of life. In conclusion, the study demonstrates that the context is permeated by experiences that cause suffering, negatively influence, and contribute to low therapeutic adherence. And thank